Kata, I'm Jordan, nurse practitioner student at GW. Can I verify your name and date of birth?
My name is Kata Chaffee, and my birthday is March 7th, 1988.
Awesome. If you feel uncomfortable at all during the exam, please let me know.
Okay.
Washing my hands. Okay, so we'll go ahead and get started. So I know I just asked you, but what is your name?
My name is Caitlin Chaffee.
Okay, and where are we?
We are in your apartment.
And what are we doing?
We are going to do a head-to-toe physical exam.
Awesome. You're alert and oriented. Can I ask you when your mom's birthday is?
Her birthday is April 29th.
And what time did I tell you to come today?
You told me to come at about 12:30.
Okay, your memory, remote, and recent are intact. Can you spell the word world backwards?
World backwards. D-L-R-O-W.
Okay, great. And what are the similarities between an apple and an orange?
They are both fruit.
Awesome. So your celebration and similarities are intact as well. So moving on, I'm just going to take a look at your whole body. So I can see that you, your skin looks all, no signs of any redness, no swelling. I don't see any masses, no tattoos or scarring. Taking a look at your head, it's a nice blonde color, thick in texture. Can you mind if I feel?
Sure.
Okay, any tenderness when I press?
No.
Okay, so I don't feel any nodules, no masses or bumps. Great. I see your skin is a nice warm temperature, good skin turgor. Awesome. All right, moving down your face here. Just gonna take a look at your, any tenderness when I press?
No.
Okay, great. So looking at your face, all your features are well defined, they're symmetric, configured in all the right spaces. We're gonna palpate your sinuses here. Any tenderness?
No, no tenderness.
Okay, I'm gonna pull down. Great, and then pulling up here. Awesome, no nodules, no swelling. Great, and then moving down, I'm just gonna feel for your TMJ.
Okay.
Okay, can you open your mouth and close and clench your jaw? Okay, great, no crepitus there. Okay, awesome. So moving on to your eyes. So I don't see any redness, no swelling around the eyes or the surrounding skin. The sclera is a nice white. The conjunctiva is a nice pink. Just pulling down here. Great. I don't see any swelling or dryness at the lacrimal ducts. No discharge. Anything like that. Any eye pain?
No.
Do you wear glasses at all?
Contacts, yes.
Okay. All right. So I'm going to have you read this, Clever One Eye, and tell me what line you could read with the smallest letters.
I can read 374258.
Okay, 37425. Okay, 20/30 vision on that. Okay, and other eye?
We'll go with the 374258 as well.
Okay, great. 20/30 vision bilaterally. Awesome job. So I'm going to have you follow my finger as it goes and where it goes, okay?
Okay.
Okay, great. And the finger's going to come closer to you if you could just follow it. Okay, great. Awesome. I'll have you cover one eye and tell me when you can see my fingers in your peripheral vision.
Okay. Now. Now. Now.
Great. Other side.
Now. Now. Now.
Okay, great. I'm going to have you smile, frown, okay, wrinkle your forehead, okay, puff out your cheeks. Awesome job. All right. And then I'll have you close your eyes again. You can just tell me when you feel this cotton ball on your skin, okay?
Okay. Now. 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 Now.
Great. Your sensation's nice and intact. All right. Just going to take a look at your eye. So I'm going to dim the lights. All right. You just take a look here. Awesome. Normal reaction to light. Normal reaction to light. All right. Then I'm going to take a look closely at your eyes. Just going to feel here. All right. So see this, there's no opacities. The red reflex is normal. Okay. Arteries and veins look well fine. No, all normal. Okay. No red reflex. No opacities. Optic disc is normal bilaterally. Looks great. All right. And now we will move down to your ears. So
Okay.
if you mind if I just put them behind
Sure.
you? Great. All right, so I don't see any redness, no discharge, no scars. Great, I'm gonna take a feel. Any tenderness?
No.
Okay, normal degree of mobility there. All right, great. I'm going to cover one ear and you tell me what you hear, okay?
Okay. JP3.
Great. And then the other side.
JP3.
Awesome. And I'm going to do it one more time, okay?
Okay. KB3. OST.
Great. Normal. All right, and then I'm going to hit this tuning fork, and you tell me if you can hear it equally or more in one ear, okay?
Equally.
Equally. Perfect. All right, and then you tell me when you stop hearing the sound, okay?
Okay. Okay.
Great. Other side.
Okay. Okay.
Great. Great, so no signs of any conductive or sensorineural hearing loss there. All right, and now I'm going to just take a look with my otoscope inside your ear. Any pain in your ears at all?
Nope.
All right, I'm actually just gonna fix here. Get the wrong part out. All right, and you look here. Tympanic membranes, nice curly gray, no foreign bodies, no redness, swelling, ulcerations, no signs of perforations. Great job. I'm gonna take a look inside here. Same thing, no foreign bodies, no impaction, no perforations. Tympanic membranes are nice curly gray. Great. All right, now moving down to your nose. I don't see any redness, no nodules or swelling, no signs of any deviations, okay? I'm just gonna take a look inside. Awesome, no signs of any ulcerations, no redness, no nodules, polyps, no swelling. Same thing on that side. Great, great. And I'm gonna have you include one nostril, take a breath in. Okay, relax. Great, other side. Great, any difficulty doing that?
No.
Awesome, I'll have you do that again. Close your eyes and tell me what you can smell.
Okay. Smells like cinnamon.
Cinnamon, that's correct. All right, and then this one.
Watermelon.
Watermelon, awesome. All right. I'm gonna put on my gloves. I'm gonna take a look inside of your mouth. Any history of any tooth loss?
Just my wisdom teeth.
Okay.
Yeah.
All right. I'm gonna take my tongue depressor and my pen light so I can get a good look. Okay, open wide. Great, so there's a symmetric rise of your soft palate, the uvula's midline. I don't see any signs of any thrush or swelling, no redness. Okay, just gonna move your tongue to one side. No thrush on your tongue, normal geography, and on the other side. Awesome. All right, there's a normal amount of teeth in there, like you said. The tonsil or bursa looks normal. Great. The gums, the gingiva are nice, coral pink. Great. So I'm gonna just have you stick out your tongue. Great, and then move it to the right and to the left. Okay, any difficulty doing that?
No.
Okay, great. So we won't be testing the gag reflex today, or the corneal reflex, but everything inside of your mouth looks normal. All right, I'm gonna wash my hands. All right. And then we're gonna move down to your neck. So I don't see any signs of any deviation of the trachea, no signs of webbing on your neck, no redness, no swelling. Okay, I'm gonna feel through your lymph nodes here, okay? Any pain?
No.
Okay. They're nice and movable, soft. I don't see any enlarged lymph nodes, nothing that's hard or tender.
Okay, good.
Great. All right. I'm gonna have you swallow. Any difficulty doing that?
Nope.
I don't sense any dysarthria, no trouble with your voice. Okay. And I'm gonna have you. We're gonna test your thyroid.
Okay.
So if you can, I'm just gonna come around here. if you could swallow for me. Okay, and then the other side. Okay, great. So I don't see and sense any enlargement of the thyroid, no sense of goiter, no nodules that I've palpated there. Awesome. All right, so I'm gonna have you try to shrug against my resistance. Great, and then look into my hand. Other side. Great. Okay, everything looks normal there. So here, I'm gonna have you put your hands on your thighs and quickly move them up, down, up, down. Great, awesome. And then stop, okay? And then put your finger to your nose and then follow my finger as it goes. That's it, yep. Awesome, okay, and as you're moving, I don't sense any tremors, with intention or at rest. Okay, I'm gonna have you close your eyes for the next few exams, okay? So hold your fingers out and tell me what direction they're moving.
Up, down, up, down.
Great, and then moving with your toes, tell me what direction.
Up, down, up, down.
Great. All right, and then I'm gonna hit the tuning fork and you tell me when you feel the vibrations, okay?
Okay.
Hold your fingers.
Now, 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 now.
Great, and then we'll move you to your toes.
Now, 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 now.
Great. All right. Everything is normal there. I'm gonna have you keep your eyes closed, okay? And then you tell me when you can feel this soft touch, okay?
Okay. Now, 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 now.
Awesome job. Keep your eyes closed for me, and you tell me if you feel sharp or dull, okay? This is just a little dull. Oh, sorry. You tell me what you feel.
Okay. Sure,
Mm-hmm.
sure. Dull, 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 dull. Sure?
Yep, that's correct. Keep your eyes closed for me, and I'm gonna have you name what object that you feel in your palms, okay? You can close your palm on it.
Hair clip?
That's right. And then your other palm.
A rubber band.
Exactly. Awesome job. All right. Moving on in our exam, I'll have you stand up.
Okay.
Okay. I'll have you close your eyes and hold your arms out doing the Romberg exam. Okay, great. So I sense a minimal swing, actually little to none, which is completely normal. Great. And then I'll have you walk a few steps to the screen.
Okay.
Heel toe. Great. And then normal on the way back. Great. And in this exam, and as you're walking in, I sensed a normal walk, normal gait, normal swing and stride, very balanced. Okay. I'll have you sit down. Okay. So now we will do the respiratory exam.
Okay.
All right, so just taking a look here from the side, I see their AP diameter is normal. I don't sense any barrel chest or any difficulty breathing. Looking at you here, I don't sense any acute respiratory distress. I don't notice any use of accessory muscles, no retractions. That looks great. Okay, so I'm gonna first take a look at your back. So if we can just move the chair a little bit up. Great job. All right. So from here, just taking a look at your back again, I don't sense any signs of any rib fracture, no redness, swelling, bruising, any difficulty breathing right now. Okay, so I'm just gonna palpate here.
Okay.
Palpate for your ribs. Any tenderness?
Nope.
All right, great. Normal. Okay, I'll have you take a big breath in, big breath out. Great, so normal thoracic expansion there. Both sides moved symmetrically and evenly on both sides. Now every time you feel my hands, if you could say the word 99.
Okay. 99, 99, 99, 99.
Awesome, no signs of any consolidation there. And then I'm going to have you do percussion, okay? This is just a light touch. Great, normal and all lung fields. I'll have you take a big breath in and hold it.
Okay.
Okay, breathe out and hold it. Okay, great. Normal diaphragmatic expansion on that side. Okay, again, breathe in and hold it. Great, and then breathe out and hold it. Okay, great. Normal diaphragmatic expansion as well, excursion as well. All right, and then I'm going to take a listen to your lung fields that I just percussed. Doing okay?
I'm doing great. Thank you so much.
All right. Breathe. Try to just get under your sweat spot, okay?
Okay.
And then laterally. Great. I see. I've heard clear lung sounds in all areas. No signs of any like adventitious breathing. No abnormal breath sounds. Okay, great. And every time you feel my stethoscope, if you could say the word E.
E, 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 E.
Great. And then this time, if you could say the numbers 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Awesome. Everything is normal there. Great job. So now I'm going to move to the front. So again, just taking a look here. I don't see any signs of acute respiratory distress. No bruising. I'm just going to feel, okay?
Okay.
Any tenderness?
Nope.
Okay. Moving here. Awesome. No signs of any rib fracture or anything like that. All right. And now, every time you feel my hands, if you could say the word 99.
99. 99.
If you could just lift your breasts up for me.
99. 99.
Great. And then we'll move into percussion of those spaces, okay? Lift your breasts up for me. Thank you. Okay, great. No signs of any consolidation. Then I will have you stay as I take a listen. Just breathe. Okay, if you press up for me one more time.
Oh.
Yeah, perfect. I'm gonna come underneath your bra, okay?
Okay.
Other side. And one more. Great. And then now if you can just say the word E again.
Okay. E, 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 E,
Amazing. Thank you.
E, 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 E.
Great. And then last time the number 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Thank you.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Great. All right. No signs of any consolidation. Everything sounds normal. Great. Moving on to cardiac. So I don't see any visible pulsations. Your circulatory system looks good. Everything looks well perfused. The temperature of your skin is normal. I'm going to take a look at your cap refill. Great. Less than 3 seconds bilaterally, and then just taking a look at your toes. Great. Less than 3 seconds bilaterally, your hands and toes. All right. Then I'm just going to feel.
Okay.
I don't feel any lifts, no heaves. Great. And I'm just taking a feel of your MCL. Okay, great. That area looks normal, feels normal. Mitral PMI. Okay, and then I'm just gonna take a list. Actually, no, let me palpate your pulses first, okay?
Okay.
So I'm just gonna palpate your radial pulse. Great, 2+, and then perfect. And then if you can just relax your arm, I'm just gonna feel for your epitrocular lymph nodes. Okay, I don't really feel them, which is normal. They're not enlarged. They should be soft and non-tender. Any tenderness?
No tenderness.
Okay, great. Awesome, normal on that side. And then I'll have you hold your breath. I'm just gonna gently feel for your carotid artery. Great, pause, and then breathe out, and then breathe in again. Okay, normal the carotid artery as well. Okay, great. And then I'm just gonna take a listen. First with the diaphragm, and then with my bell.
Okay.
So that was aortic, pulmonic, Erb's point. This is tricuspid. Okay, and then the mitral is gonna come here. Okay, moving back to the tricuspid. Can I have you lean forward a little bit? Okay, no sense of any aortic regurgitation there. Awesome. Great, I'm gonna switch to the bell. Listen for any bruits, okay? No bruit. No bruit. No bruit. Bruit. No bruit. Okay, no sense of any mitral stenosis there. Okay, and then I'm just gonna take a listen to your temporal pulses for any bruits up here. No bruit. No bruit. And then if you can hold your breath for the carotid. No bruit. Breathe out. Breathe in. Hold your breath. Okay, no bruit on that side as well. Awesome. All right, I'm gonna have you slightly slide down into the chair. Just gonna assess your JVT. Whoops. All right, just taking a look here. Okay, I'm not gonna measure here at the exam, but I don't see abnormal pulsations, no enlargements. I don't sense any distension. Okay, the extent of the JVD looks normal. Awesome. All right, and then I'm gonna have you go to the lower bed we have here.
Okay.
Okay. All right, great. I'm gonna have you actually lay down for me. I'm gonna continue the cardiac exam. So I'm just gonna take a feel. Again, I don't sense any abnormal pulsations, no discolorations, no bruising. Okay, just feeling here, no lifts or heaves that I can feel. Great job, feeling again down here. Okay, normal, all right. And then I will palpate, actually no, I'm gonna auscultate first. Okay, the same areas, first with the diaphragm and then with the bell, okay? Can you lean a little bit over to the left side?
Okay.
Perfect, yep, thank you. Amazing, no signs of any mitral stenosis or aortic regurgitation. All right, can I have you just slip off your pants just so you can feel for your pulses? Doing okay?
Yeah, this is totally fine.
Great. Awesome. All right, just taking a look at your abdomen. I don't see, do you mind if I lower this?
Sure.
Great, I don't see any discolorations, no bruising, no masses that I could see. The umbilicus is in its normal spot. I don't see any hernias or bruising or any redness or swelling. Can I have you lift your head up off of the ground? Perfect, no sense of any diastasis recti or hernias, you can lower. Great, okay. And then I'm just gonna feel for here for, actually, let me auscultate for bruise in your lower arteries, okay?
Okay.
Any bruise at the aorta? None at the renal. right? So I won't be assessing your femoral pulses today, but this is where they will be in the exam.
Okay.
All right, and then I'm just gonna feel, okay?
Okay.
Normal. Great. All right, and then I'll have you bend your knees. Just taking a look at your popliteal pulses here. And while I'm here, I'll also assess your lymph nodes. All right, it's kind of hard to tell the popliteal pulse, but that's normal. I don't feel any enlarged lymph nodes, nothing harder or tenderness. Any tenderness? Any tenderness?
Oh, no,
Okay.
no tenderness, sorry.
Great, it's okay. All right, and I'm just gonna feel for your pedal pulses. Okay, normal 2+, Marcellus pedis. Great job. All right. Normal, everything looks normal. All right, and then I'm gonna continue here for the abdominal exam.
Okay.
So if you can just lower your pants, perfect. All right, again, I don't see any signs of distension, no bruising, nothing abnormal here. It's a normal contour, nice and flat. The skin is a nice temperature and color. Great, I'm just gonna also take for bowel sounds, okay?
Okay.
Okay, and now I'm gonna just, perfect, all done. Normal octo bowel sounds and all 4 quadrants, okay? And now I'm just gonna percuss.
Okay.
Great. And panic in all 4 quadrants. I'm just gonna feel down here for your bladder. Okay, not super dull, but you just emptied your bladder before the exam, so that could be it. All right, and then I'm just gonna try to percuss the spleen. If you could take a big breath in and hold it. Okay, great, and then a big breath out and hold it. Okay, no sense of an enlarged spleen, no splenomegaly. Okay, and I'm just gonna percuss over here to your liver. Okay, nice and dull. Perfect. Okay, and I'm just gonna continue with palpation.
Okay.
First light and then deep. Let me know if you have any pain.
Okay.
Okay, any pain, tenderness?
No.
Okay, great. Now it's deep palpation.
Okay.
Any pain?
No.
Great. I don't feel any masses. No enlargements, no bruising. Don't sense any guarding. So that's normal. Okay, I try to palpate your spleen. Don't think I will be able to, but that's normal. No sense of enlargement. Okay, and then if you could take a big breath in and let it out. Okay, feeling for your liver, nice smooth edge, normal borders, no signs of any liver enlargement. All right, and then I'll have you sit up. If you can turn around, face me, so the screen is on. Perfect. I'm just gonna sense for CDA tenderness, okay? Let me know if you feel any pain. Pain?
No pain.
Pain?
No pain.
Awesome. All right, I'll have you come back to sit.
Okay.
Doing okay?
I'm doing great.
All right. Okay. Okay. So let me just assess your deep tendon reflexes really quickly.
Okay.
You can hold out your arms. Okay. First your radial. Great. And then you can relax your arm for me. Awesome. Actually, let me go down here. Relax. Great. Here, relax. Awesome. All right. And then I'm going to come down to your knees.
Okay.
You can relax your knee for me. Great. Great. All right. And then the back of your Achilles. Great. Awesome. All right. And then I'm just going to see the sole of your foot.
Okay.
I'm going to make that number 7. Okay. Normal. Awesome. Normal direction of your toes with that. Awesome. All the deep tendon reflexes are 2+. completely normal. I'm gonna wash my hands. Okay, moving on to the last portion of the exam.
Okay.
Your musculoskeletal system. So I'll have you just stand up.
Okay.
Okay, so as I've noticed when you sitting and standing seem to be no apparent difficulty for you, no great posture. All of your muscles are evenly distributed in some metric, no sense of atrophy anywhere, no swelling or discolorations, no bruising that I could see. All right, and then I have you just step a little bit forward. Perfect. All right, I'm just gonna palpate here. Any pain?
No.
Okay, palpating your spine and the paravertebral muscles. Any pain?
No.
All right. Okay, and I'm gonna have you look to the ceiling, look down, look to the right. Okay, and then come back to center. Lift your head, lift to the left. Great, come back to center. Great, I don't sense any crepitus there. If you can reach down and touch your toes as much as you can. Okay, great, no signs of any scoliosis or abnormal curves of the spine. Great, you can stand back up and then gently lean back. Great, can you lean back a little bit? Perfect, yep. And then you can stand up, great, and then rotate to the right. Okay, come back to center. Try to keep your feet still.
Yep.
You got it, perfect. Yep, and then back, other side, great. And then reach down to the right, bring your fingers to the floor, okay?
Like that?
Yep, come back. And then just try to just reach your fingers down.
Just
Don't-
my fingers. Okay.
Perfect, yep. And then come back, other side. Perfect. I don't sense any crepitus. Any difficulty doing that?
No.
Okay, great. I'm gonna have you sit back down.
Okay.
Assessing for your shoulders, okay. Perfect, yep. All right, so I'm just gonna feel, I don't sense any bruising, no dislocations or discolorations, okay. Feeling here, any tenderness?
No.
Okay, feeling for your clavicles. Okay, great. Awesome. Great, I'm gonna have you reach your arms forward. Great, bring them down and then try to reach them behind you. Perfect, and back. Okay, reach your arms out to the side. Perfect, and then down and over your body, over the front of your body, like cross your arms forward. Perfect, yep. And then bend your elbows, like make a touchdown. Perfect, and then bring your hands behind your head. Perfect, yep, down, and then bring them back, touchdown. Yep, and then try to touch your back with your hands and then keeping your shoulders still.
Like that?
That's it, yep. I don't sense any crepitus while you do that. Okay, so now we'll just assess your strength. So if you could do those motions again. So arms forward, try to resist my hands. Great, and then try to reach behind you. Perfect, sorry, it's a little tough with this.
Yeah, it's okay.
Perfect, okay. And then reach your arms out, away, perfect. Okay, and then try to bring them down. Resist, amazing, okay? And then bring your arms back. Okay, try to do that same motion. So bring your fingers down. Try to resist, like your hands down.
Oh, sorry.
It's okay. Great, and then try to bring your hands behind your head, resist, and then try to touch your back. Resisting, perfect. 5 strength in all of those motions, okay? Great, and then we'll move down to your elbows. So
Okay.
I don't sense any nodules, no swelling, I don't see any discolorations, any pain with at your elbows?
No.
Okay, the Elkanon fossa is normal, bursa, no bursa, okay? All right, and then I'll have you bend your elbows, perfect, straighten them out and extend them down to the floor, great, and I'll have you bring your hands to the, so keep your arms out like this and then try to twist, perfect, and the other side, amazing, yep. So then we're gonna try to test your strength, so try to bend your elbow, keep your arms out,
Okay.
all right, face the ceiling, yep. Try to bend your elbows and resist my hand. Perfect, okay, and then try to straighten them out and just resist me from the back.
Okay.
Amazing, all right, 5+ in those areas as well. Moving down to your wrists.
Okay.
Just gonna feel here. I don't see any swelling, no nodules, any history of like carpal tunnel or anything.
Nope.
Okay, I don't sense any fogginess, no swelling or nodules, no redness. All right, great. And then moving to your fingers, have you extend out. Okay, again, any pain?
No.
All right. So far I haven't sensed any crepitus anywhere and I don't sense any crepitus here. Great, so then we'll point your fingers to the ceiling. Great, bring them down. And then the others, bring them to the ground. Perfect. Okay, relax, and then bring your fingers toward each other. Perfect. Back, the center, another side, away from each other. Amazing. Okay. Try to do that. Those things again, resisting my hand. Okay. So fingers up. Perfect. Fingers down. Great. And then try to bring your hands together. Perfect. And then apart. Amazing. 5 plus. 5. Perfect. All right. And then I'll have you flip your hands and then try to squeeze my hands as hard as you can. Amazing. And then bring your thumb to the rest of your hand, all the rest of your fingers. Perfect. And away. Okay. And then bring your thumb to each one of your tops of your fingers. Great. Any tenderness doing that?
No.
Okay, great. And then I'll have you bring your hands into a ball, extend them out. Okay, great. And then try to resist your thumb coming in. Great, and then out, other side. Amazing. 5. Strength in those areas. Okay, I'll have you come quickly to the ground.
Okay.
Just assessing your hip. All right. Okay, so you can lay down to the back if you don't mind. All right. Okay, so I don't see any dislocation of your hips, any pain when I press?
Nope.
Okay, great. So we'll start with this leg.
Okay.
You can lift it up. Okay, and then if we had more space, I'd ask you to try to stretch your leg back. Okay, great. That would be extension. And then I'll have you try to bring your leg away from your body. Yep, and then back and over your other leg. Perfect. Okay, I don't feel any crevice there. Okay, and then we'll bend your knee. Okay, I'm gonna feel here. Try to bring your leg out and back. Perfect. And we'll do those same motions with just testing your strength.
Okay.
So lifting your leg up, try to resist. Great, and then down. Great, and then away. Great, and then forward. Great, and then bending your knee. Try to resist coming in. Great, and then resist coming out. Amazing, okay? And then we'll do the other side. So lifting your leg up. Okay, great, and then back. We'll imagine your leg is going to the back. Okay, great. And then away from your body. Okay, and over. Great, bending your knee. Bring your leg in. Perfect. And then other side. Amazing. All right, we'll do those same things, testing your strength. So lifting your leg up. Great, resisting knee down, away from your body, toward. Okay, bending your knee, resist, and resist. Amazing, no crevice, any pain?
No.
Okay, 5, strength, normal. Okay, and I'll have you sit back into the chair.
Okay.
Finishing up the exam here. All right. Let's get you back into vision. Perfect. All right. And then, so we did elbows, hands, and then we'll move down to your knees. So let's actually do this here, getting fancy. Okay. So I don't sense any redness, no swelling. Okay, I'm just gonna take a feel. Any knee problems?
No.
All right. No nodules. No sense of any dislocations. Patella looks good. All right. So I'll have you try to bend your knee. Yeah, perfect. And then straighten it out. Great. A little bit crevice there.
A little bit, yeah.
Yeah, that's okay. All right, and then do the same thing. Try to resist my hand. Okay. Perfect. And then out. Amazing. Okay, other side. Straighten your knee out. Great. And then bring it in. Great. And then again, try to resist. Back. Perfect. All right, great. 5, strength, and just some crevice on your right knee. All right, and then moving down to your ankles. I don't feel any I don't see any swelling. I don't feel any nodules or abnormalities here. There's been no atrophy around your body. That's great. Okay, and then let's see. Can you lift your feet off the ground? Okay, great. And if you could try to plant your feet down, like point your toes down.
Oh, point your toes.
Yep, perfect. And then put your toes to the ceiling. Great. And then try to lift your inner arches up to the ceiling.
Like that?
Yeah, try to lift your.
Oh, I see.
Perfect.
Okay.
Yeah, exactly. And then bring your arches down to the floor. Great. Okay, and we'll try to do those without. So try to resist me.
Okay.
Perfect. And then plant down. Great. And then try to invert your feet. And then an eversion. Perfect. All right. And then I'm just gonna feel here. Any pain when I press on your toes?
Nope.
Okay. No abnormalities there. The skin looks good. No redness, swelling. Okay. I'll have you bring your toes. Perfect. And extend them out. All right, great. I don't see any corns, no calluses, anything like that. All right, well that concludes our exam, Kata.
Thank you so much.
Thank you. Have a great day.
Thank you.
Washing my hands.